Australia has become the latest continent to confirm a case of the coronavirus, which originated in China. 3 cases have also now been found in Europe. All 3 appeared in France, in the capital Paris, and in the city of Bordeaux. Health officials there said a 48-year-old patient had been traveling through China and passed through Wuhan. That's the epicenter of the outbreak. France's health minister said authorities are not ruling out finding new cases.
We are going to do everything possible to contain this epidemic, knowing that it is possible and even probable that there will be other cases, particularly in Europe. Just because there aren't any other identified cases today doesn't mean that no other cases are circulating.
Meanwhile, here are the latest numbers in China. The virus has now killed at least 41 people, with more than 1,300 others affected. Authorities are taking unprecedented measures to try to stop the spread of the virus. Travel restrictions remain in place in over a dozen cities in China, and all of the country's 70,000 movie theaters have also been closed. The actions are urgent as millions are on the move over the Lunar New Year holiday.
As the scale of the outbreak grows, so too does the urgency of the response. In Wuhan, construction is underway on a new hospital for coronavirus patients. Chinese authorities say it will be complete in just over a week. The city at the outbreak's epicenter remains under a transport lockdown. Road checks. Drivers with a high temperature are sent to hospital. Across China, almost 40 million people face travel restrictions during the important New Year holiday.
A lot of people had no way to get home. I really feel for them, because I can understand what it's like to have been working hard away from home for a year. Everyone looks forward to being with their family, but in this situation, there's really nothing we can do.
The outbreak even featured on state television's Lunar New Year broadcast, with hosts sending messages of support to medical staff. In airports across the globe, scenes like this are becoming common. Officials using thermal monitors to screen travellers for signs of fever. Around the world, concern is heating up.
Well, we have team coverage on the spread of that virus. I'm joined now by DW correspondent Lisa Lewis. She is in Paris, and Fabian Kretschmer in Beijing for us. We want to start with Lisa. Lisa, the first European cases of the virus have now been confirmed. Those are in France. What more can you tell us about the situation there and those infections?
Well, the authorities have said that all these 3 people recently traveled to China and then came back. One person, a 48-year-old man in Bordeaux in southwestern France. He apparently is from China. He's French. He has French nationality. He went to see SOS Médecins, which is an overnight doctor service, or over the weekend. And they very quickly identified the symptoms. And also when they learned that he was actually from Wuhan, where the virus comes from, really, they put him under quarantine and transferred him to a hospital. The authorities here are saying that 2 more cases have been detected in Paris. It looks like it was first one person and then someone else who had been in touch with that person. Obviously, the authorities are trying to reassure everybody and saying we've got everything in place to deal with this, especially as we had to deal with other diseases that were similar in the past.
Okay, Fabian Kretschmer now in Beijing. It's the Chinese New Year today, but celebrations not taking place as usual. How is China responding?
Yeah, I'm in Beijing right now, and here the public gatherings, they have been cancelled. Also, the tourist attractions have been closed. The parts of the Chinese Wall have been closed, and there definitely it doesn't feel like a typical Chinese New Year. Usually, it's also the season where domestic spending is really high. But now people prefer to stay at home. They don't go to restaurants. They don't spend so much on gifts for their families. So yeah, it definitely feels quite different. And if you ask the population, then especially among the young, there's also some kind of anger against the local authorities in Wuhan, in Hubei province, because just 2 days before they shut down the city, shut down all the transportation, they were attending lavish sing and song dinners, and they really cannot understand well the party authorities tell the people to wear face masks and to avoid all public gatherings, but of course they themselves act quite differently.
Lisa, what about there in France? What measures are French authorities taking to stop the spread of the virus now that we are seeing the first cases appearing there?
Well, the authorities have said that they are well prepared. There are three specific hospitals in Paris that are prepared to deal with such infectious diseases. The health minister, Agnès Buzyn, said yesterday that people, if they had similar symptoms, that they shouldn't go to see someone at the hospital or contact their local GP. There's a special helpline they need to call, and then people will come and make some tests at their home and then maybe bring them to specialized services. Obviously, the health minister said that she would give a daily update on the situation. She said there are probably going to be more cases like this in France. And she also said that probably these cases were first detected in France because France had developed as one of the first countries a method to detect the virus. Now, people here are obviously quite concerned about this. If you look at social media, they're really wondering why there aren't systematic checks at airports, because there are people who've talked to French media in the past saying, you know, I just got home from China and no one actually checked me. No one controlled me.
All right, Lisa Lewis with the latest there in Paris and Fabian Kretschmer for us in Beijing. Thank you to you both.